This video will explore the topic of ethics and the ethical issues that are relevant to all health professionals, in particular professionals in the nursing industry. This video will reference a case study that discusses suicide, which may be distressing to some. Please contact Lifeline Australia on 131114 for support. So, what exactly is ethics? When researching this question, there was no absolute definition for the word ethics. This is likely due to the fluidity and continuous development of the word, in order to adapt to the different fields in which ethics is applied. Philosophers generally categorize ethics into four main branches or approaches: meta-ethics, descriptive ethics, normative ethics, and applied ethics. Ethics is the study of morals that define right and wrong or good and bad conduct. Ethics is the standards or norms of how to act and for analyzing complex problems and issues. The nature and dynamics of ethical principles and the way we learn and acquire moral beliefs varies from person to person and is derived from dilemmas, people, values, views, and experiences in which each person faces. Another way of defining ethics focuses on the disciplines that study standards of conduct. For instance, ethical standards govern conduct in medicine, law, engineering, and business. Ethical studies exist to ensure that all professionals in their respective disciplines can be held accountable to the public. What ethical issues are commonly faced by nurses? Nurses face daily ethical challenges in the provision of quality care, according to a report by Ulrich and colleagues. The 5 most frequently occurring ethical issues surrounding patient care were protecting patients' rights, autonomy and informed consent to treatment, staffing patterns, advanced care planning, and surrogate decision-making. These findings were consolidated by the results from research conducted by Johnston and colleagues, which cited protecting patients' rights and human dignity, providing care with possible risk to your health, respecting or not respecting informed consent to treatment, staffing patterns that limit patient access to nursing care, use or non-use of physical or chemical restraints. Apart from the frequently occurring ethical challenges, both reports have stated that nurses are also faced with the challenges of unethical practices of healthcare professionals, the breaches of patient confidentiality and right to privacy, and end-of-life decision-making, as well as the prolonging of the dying process with inappropriate measures and the caring for patients and families who are uninformed or misinformed. These are also ethical challenges that are faced by nurses on a day-to-day basis. In order to address these ethical dilemmas, there are a range of frameworks, codes, and guidelines in place for nurses to refer to, which are available from the Nursing and Midwifery Board of Australia, or the NMBA. These documents help nurses understand the board's expectations and requirements and provide pathways for nurses to meet them. These documents include the Codes of Conduct for Nurses in Australia, the Framework for Assessing Standards for Practice for Registered Nurses, Enrolled Nurses, and Midwives, and the National Framework for the Development of Decision-Making Tools, such as the Code of Ethics for Nursing and Midwifery Practice, all of which are available online. Nurses also follow ethical principles outlined by Garrett and colleagues. Ethical principles are the core of ethics in healthcare. There are 4 primary principles, which is justice, to be fair, autonomy, which is to respect the individual, beneficence, which is to do good, and non-maleficence, which is to do no harm. The 2 secondary principles is veracity, which is to be truthful, and fidelity, which is to be loyal and keep promises. There are 3 ethical theories. The first is deontology, which refers to the duty and rules, consequentialism, which means the outcomes or consequences, utilitarianism, which is the sub-branch of consequentialism and holds the right action dependent on the outcome that provides the most benefit, and virtue, which focuses on the moral character or the virtues of the individual. The case study we will be discussing in this video is the patient suicide attempt and ethical dilemma. This case is about Mr. Green, age 57, who was diagnosed with prostate cancer 7 years ago. However, he declined both medical and surgical treatment at the time. During the 7-year period, Mrs. Green chose to seek alternative treatment, however, did not follow with any specialist or urologist. The cancer has now become aggressive and has spread locally to his lymph nodes, invading the bladder and partially obstructing the left kidney. Mr. Green has now been advised that due to the growth of the tumour, he may only have 4 to 6 weeks to live. It was determined that any further surgical or medical intervention would not be appropriate in this case, and that a palliative care regimen was the next step. He confided in one member of the nursing team in the oncology department of his suicidal thoughts and that it was a secret that the nurse was not to tell anyone. The parties involved in this scenario is not exclusive to the nursing staff and Mr. Green. Other health professionals that are involved in Mr. Green's care and Mr. Green's family and friends will also be affected by this ethical dilemma. The ethical dilemma in this scenario is if the nursing staff should tell other healthcare team members about the patient's suicide attempt or thoughts without the patient's consent. So what are the ethical principles and theories that are in conflict that form the ethical dilemma? When considering Mr. Green's case, 4 ethical principles are in conflict: respect for autonomy, non-maleficence, beneficence, and fidelity. All of the 3 theories are also in conflict: deontology, consequentialism, and virtue ethics. The nurse that Mr. Green confided in must consider all of the following before resolving the ethical dilemma. If the nurse were to keep the secret, there will be respect for Mr. Green's request for confidentiality, the promise will be kept, and the nurse will also have Mr. Green's trust. The nurse will also be completing their role as his nurse and also as his confidant. However, there will be no preventative measures taken to stop Mr. Green from self-harming. If the nurse decides to tell another health professional, this may mean they are disrespecting Mr. Green's request for confidentiality and they will break the promise that they have made to a patient. However, this may result in the prevention of Mr. Green's possible suicide attempt, and he will also get the assistance from health professionals, which aligns with the duty of care as a health professional and as a nurse. In the end, the nurse chose to share the information of Mr. Green's suicide attempt with other healthcare professionals. First of all, she stabilized the patient's mood and prevented impulsive behavior by providing psychological comfort. The head nurse was informed and the nursing team was established in order to help Mr. Green. They followed the self-harm and suicide protocol of the hospital and identified concerns with Mr. Green. These concerns were addressed appropriately and collaboratively with other healthcare providers as well as family members. This resulted in Mr. Green passing peacefully without another thought of committing suicide through his last days alive. So, how do we ensure ethical practice? Apart from the resources mentioned previously, health professionals such as nurses should have access to guidelines that discuss preventative measures in response to expressions of suicide. Research have theorized that a therapeutic relationship between nurse and patients have the potential to reduce rates of suicide through prevention, education, and providing care that promotes the healing of patients who attempt suicide. Thus, a guide for nurses to initiate and maintain these therapeutic relationships is recommended. Samuelson and colleagues have also found that the nurses working within psychiatric services were more understanding and more willing to nurse suicide attempt patients compared to nurses in other disciplines. There is a perceived need for further training in suicidology for nurses in the general hospitals in order to understand and prevent patients who express suicide thoughts from acting upon them. This training can potentially increase the sensitivity of nurses towards patients who are at high risk of attempting suicide. Furthermore, potentially changing the perceived negative attitudes of nurses, which is possibly derived from the lack of knowledge and uncertainty of how to nurse this patient group. Nursing as a health profession or discipline is adequately equipped with the resources as mentioned before. Therefore, all health disciplines should also have codes of conduct, codes of ethics, frameworks and guidelines to ensure that ethical practice within the health professional body is maintained and regulated. This is to strengthen the quality of care and the provision of health services amongst all people. Thank you.